So welcome all who have joined today for this webinar. This is the 9th day of the Kerala Cancer Crusade and Cancer Literacy Mission, the IRIA Preventive Radiology National Program, in association with Indian Radiological and Imaging Association Kerala, Sosti Foundation, and the Community Oncology Department of Regional Cancer Center, Thiruvananthapuram. We had several discussions, where several topics being discussed here in this Breast Cancer Awareness Month, not only about breast cancers, also head and neck cancers, and the cancer cervix and the gynecological malignancies. Because as part of the Kerala Cancer Crusade, we have identified that there are certain malignancies apart from breast cancers also that needs to be addressed, that needs to be downstaged so that better survival rates and better quality of life is possible. But today, as we are nearing the Breast Cancer Day, that is October 30th is a Breast Cancer Day, and this session, we will have a speaker from United States, Dr. Lobamudra Roy, who is a founder president of Breast Cancer Hub, who will be talking to us on breast cancer challenges, sustainable solutions, and saving lives. From her unique experience, she being a researcher, scientist, professor, and social entrepreneur, has got a lot to say. And from the ground work that she has done, she has got a lot to share with us, which will be immensely useful for all the volunteers, for all those who sincerely wants to put Kerala Cancer Crusade and the Cancer Literacy Mission into action. Before going into the academic session, I have the pleasure to introduce and invite Dr. Amal Anthony, the President-elect of Indian Radiological and Imaging Association, Kerala, who will be giving the presidential address. Dr. Amal Anthony is the head of Department of Radiology in Lisi Hospital, Ernakulam. He was the past National Vice President of Indian Radiological and Imaging Association and the governing body member of Indian College of Radiology and Imaging. Over to you, Dr. Amal.
Thank you, Dr. Rijo. It gives me immense pleasure to be part of this Kerala Cancer Crusade and Cancer Literacy Mission. And it is even more laudable that it is the 9th day of continuous preventive treatment radiology program which is going on. And it heartens me that IRIA has taken the lead in promoting this concept of preventive radiology at the national level. And IRIA Kerala, under the effective leadership of Dr. Rijo Matthew and Dr. Gomati, has taken this forward to find interesting groups across the state to continue with this mission. And I'm sure that this is not a one-time mission. This is an ongoing mission because the crusade against cancer is not for a day or a month or a year. It has to continue on and on until we taste victory. What I have to say today is that over the years, or the last few years, the treatment, our aim at completely eradicating cancer through treatment hasn't lived up to our expectations, like the progress we have made in other fields. So naturally, we had to go back to our old adage, that is, prevention is better than cure. And this change in paradigm has already yielded rich dividends in various cancers. And so this particular Kerala Cancer Crusade and Cancer Literacy Mission is something which is very important, not only for our state, but across the country. And I'm glad that today we have a speaker from US talking, that is Lobamudra Das Roy, talking to us about breast cancer challenges, sustainable solutions, and saving lives. And this being the Breast Cancer Awareness Month, a lot of programs are going on, but this stands out by its sheer academic nature, and not only academic nature, but its social impact, because the groups which have come in are Kerala Swasti Foundation and the Community Oncology Center, Community Oncology Department of Regional Cancer Center. So without wasting much time, I wish the deliberations the very best. And I'm sure that at the end of which we'll all be charged up to face this threat of cancer in our own way with the aim of prevention as our primary aim. So once again, thank you all for giving me this opportunity and very best. And I declare that today's session is inaugurated. Thank you.
Thank you, Dr. Amal, for the presidential address. We have got the chief guest here. Father Binu Kunnath is the director of Caritas Hospital and the institutions. Father Binu Kunnath is highly enthusiastic in this campaign. My interactions with Father Binu Kunnath starts during the Preventive Onco Summit that was conducted at Trivandrum in August. Father showed immense interest in getting this movement into an action plan, and he has offered all help. And let me add on to that, on October 30th, in IRIA is organizing a breast imaging workshop and a hands-on training for guided procedures for the radiologists. And along with that, at Caritas Hospital, along with that, Father has taken initiative to do a grand launch of a Kerala Cancer Crusade Center, that is a NCD clinic focusing on the lifestyle diseases and cancer screening programs at Caritas Hospital. So that is the kind of enthusiasm, energy, and interest Father has shown towards this movement. Welcome you, Father, for this webinar. This is the 9th day of our webinar series that is going on Kerala Cancer Crusade and Cancer Literacy Mission. May I invite Father Binu Kunnath, the director of Caritas Hospital, to inaugurate this session.
Yeah, thank you very much, Dr. Rijo. I think our interaction is always keeping the fruitful moment every time. Anyway, very good evening dear friends, be in the inside the country or the overseas, especially Dr. Leopold Das Roy. Always my best wishes to all the participants in this awareness webinar. As part of Kerala Cancer Crusades and Kerala Cancer Literary Mission. Actually, from the browser I could read it. It's the 9th day of this webinar series. It's wonderful. Because during the lockdown, we could have another platform for interaction. That's a Zoom platform. Even though we are in a different part of the world, we'll be united in this platform. We can share the thought and we'll work together as a team. So considering the today's social conditions, actually, let us say that this program is most excellent. Because everybody thinking about how to develop their hospitals, departments, maybe radiological point of view, imaging point of view, cancer point of view. But this webinar shows that we are going to the community, we are going to the people, where we can save millions of people. The dreams should come true. The Indian Radiological and Imaging Association, IRIA, is currently monitoring several activities in this field. I know that. In this age where technology is taking the lead in the field of health, the efforts taken in this field should be highly appreciated. At the same time, I do believe that, of course, we should have a lot of technological improvement in our health sector. During this COVID, we were with the telemedicines, telecommunications, then teleconferences, and robot surgeries. Lot of inventions are happening in the health sector. But a preventive measure focusing on early detection of disease is essential to offer effective and better treatment to patients. This is what myself and Richo, we had a nice meeting with the Swasti Foundation at Trivandrum. 2 days conference, the community-centered program, how to prevent, how to make aware of the serious disease that's going to happen in their family, in the personal life. This has become essential to detect the disease in its early stages. That's the important thing. And help the patients to early treatment to prevent it from turning into malignant conditions. Of course, Caritas Hospital, we have a cancer institute. It's almost 20 years. We are just completing 20 years. I could see a lot of patients from the neighboring districts, Idukki, Alapi, Ernakulam, Kottayam, that side, coming to Caritas Hospital, especially the Cancer Institute. And unfortunately, a lot of people are suffering from the cancer. If could have provided the early detection or the community-centered program, they could have saved a lot of life, time, money. But we still have a long way to go in terms of cancer diagnosis. I know. Widespread awareness programs and diagnosis camps are essential in this contemporary age. But Caritas Hospital is moving forward with the new steps in this field, of course. But Crusades, the Swasti Foundations, Cancer Crusades, as the Rijo said just few minutes back, coming Sunday, we are going to launch a great, the center for this Cancer Crusades. And that shows that we are responsible for our patients. This is starting next week, and I request everyone to support this work of Caritas in this region, because I do believe that we should take a front step. But so normally the people will follow us, and we should be a model. And actually, the health system in Kerala, people are moving towards the hospital. I do believe that the hospital should go to the home, go to the people, go to the community in order to save the people. It has been realized through various experiences that the breast cancer treatment is one of the most challenging in the field of cancer treatment. eminent personalities like Dr. Lopamudra Das Roy are taking a decisive steps in this field today. I sincerely appreciate excellent social work like Dr. Lopamudra Das Roy. Only by standing together we can face the scourge of cancer that is haunting the human race. Let us work together for that. And this wonderful moment, let me congratulate Dr. Rijo Matthew, Dr. Ansar PP, Dr. Amal Anthony, Dr. Jay Krishnan, and Dimple Mohan, who are prominent in this field of cancer prevention, who are participating in this discussion. I'm a layman. I don't have any the authenticity to speak about what's cancer, the disease, the diagnosis, but I'm a healthcare provider. Few years of experience, I could say we will work together for the better of the humanity, better of the people. So let me conclude with the humble words that, of course, we need a technology, we need an advancement in every aspect. But I do believe that even though we are advanced in technology, in new innovations, don't forget, my dear friends, the humane touch in the healthcare. Whenever if we lose the humane touch, maybe in the medical terminology, we could say that therapeutic touch, when the doctors say to their patients, don't worry, macha, don't worry, it's okay. You'll be okay, you'll be ready, you'll be okay. That's a therapeutic touch, humane touch, face-to-face interactions, the face-to-face talk, the laughing space of their doctor, laughing space of the patient. That's the end result of our webinar. That should be our end result of our community program. Wish you all the best. God bless you. Thank you.
Thank you. Thank you. That was Father Binu Kunad, Director of Caritas Hospital, who gave us that message of the cancer consciousness has to be collaborated with creativity and the human touch of compassion. And thank you, Father. And let me congratulate you once again for the initiative that you have taken of starting the NCD clinic, one of the first of its kind in the private sector in Kerala. And that NCD, as you know, the prevention is a hard sell. It is always, people always say the prevention is better than cure and all these things. Prevention doesn't have is not as dramatic as the cure stories of stage advanced cancers and all. So, but prevention has got a lot of impact at the community level. If you can detect and downstage the diseases, cancers at a very early stage, it's going to make a huge economic impact, huge social impact, and huge impact on the quality of the life of the survivors. So with that message, we have embarked upon several initiatives, and one of which Father Binu Kunad has taken the lead of starting an NCD clinic and cancer screening centers in Caritas Hospital, which will act as a motivation for other private centers also to start similar NCD centers, which will be doing a lot of screening procedures, motivating people, and will be helping to detect cancers at a very early stage. Cancer detection at early stage can make a significant difference in this cancer crusade. So thank you once again, Father.
Thank you. Thank you.
Let me introduce the moderator for this session, scientific session, Advocate Dimple Mohan from Susti Foundation, who also is doing a phenomenal work. They're doing everyday camp in Trivandrum, starting from October 1st, and it will end on 31st. Everyday camp for breast cancer is being done at Trivandrum under the leadership of Advocate Dimple Mohan of Susti Foundation. And Dimple has played a very active role in organizing the Onco Summit in Trivandrum. Let me introduce and invite Advocate Dimple Mohan to take forward the scientific session and introduce the introduce our speaker today. Over to you, Dimple.
Thank you very much, Doctor, for your nice words. Well, today it's indeed my privilege and honor to introduce a very dynamic, socially committed, and highly focused personality who is a speaker for today's session, Dr. Lopamudra Das Roy, whose dream is to inculcate the art of scientific thinking, cancer awareness, and research amongst the most promising generation in this world, the youth. Dr. Lopamudra Das Roy is the founder and president of Breast Cancer Hub, a GuideStar Platinum certified top-rated 501c3 non-profit organization registered in North Carolina, USA in 2017. She's a cancer research professor, a social entrepreneur who resigned from a rewarding career in 2017 to create and grow BCH as a full-time pro bono humanitarian work, providing 100% free services with a dream to save lives. She has 18 plus years of experience in research, teaching, and mentoring undergraduate and PhD candidates in the field of genetics and breast cancer and pancreatic cancer. She received her PhD in molecular biology genetics from India, in addition to a research experience in biochemistry at Delhi University, India. And Dr. Das Roy did a postdoctoral fellowship from the Mayo Clinic College of Medicine, USA, in cancer immunology and therapeutics, focusing on breast and pancreatic cancer. Dr. Das has received the Award of Excellence for Humanitarian Service at Male Breast Cancer Coalition Conference 2019 at Orlando, USA. She is also awarded for outstanding performance on relief and welfare activities in India during COVID-19 from the Universal Diplomatic Affairs of Human Rights in May 2020. And here we are, ma'am, we are eager to listen to you on breast cancer challenges and the sustainable solutions saving lives. Over to you, Dr. Lobamudra Das Roy.
Thank you so much, Advocate Dimple, ma'am. It's an honor to know you. And thank you, Dr. Riju. Thank you, Father Binu. Thank you, Dr. Emma. Thank you, Ms. Soumya, for all the logistics and all the communication. And I would really want to thank Dr. Avni, and actually Mr. Sushil too. Without them, I wouldn't have been here today. Thank you for making me a part of your crusade, because it's amazing what you're doing. And I hope that the same will be replicated in all other states. And as Father Binu said, that together we stand. And I think cancer is a big word, and we should be standing together. And that's why, Father, our tagline is with BCH is together we save lives. So before I start with the formal, presentation today, I would just like to go back to my story. I was 12-years old, and my father, late Dr. Chandrasekhar Das, he was a pediatrician and in Assam. And my grandfather was also a physician. So in the dining table, I would always hear the stories of, it always used to be like about patients, about healthcare, everything. So, and my dad would be always an advocate for breast milk. And he would always talk about, how I would hear him telling the moms that breast milk is so important and all of that. So, but when I was 12-years old, and I was in Guwahati in Assam, and one of my friend's mother passed away, and I went for the funeral, and over there, first time I got to know about the taboo which is associated with the word cancer. Because when I asked, how did she die? And no one even wanted to utter the word cancer. But I was a very curious girl all the time. And I kept asking, cancer. And I knew all these terms. It wasn't like I knew cancer, because I heard all this word growing up. So when I asked, cancer where? And after a lot of insistence, and then it was her friend, the person who passed away, her friend, she said in a very soft way, breast cancer. I said, breast cancer? She's like, shh, I'm not supposed to talk about this. So that really left an impact on me. I felt that this is the respect we are giving to a mother. We lost her, and we can't talk about the disease that cost her life. And eventually, when I was in college, one of the professors passed away from breast cancer, but the family said brain cancer, because no one could differentiate when we had chemo and she was wearing cap and all, because the reason was they have daughters in the family, and the daughters will not get married if the family knew that it was breast cancer. So all these concerns, eventually I became a cancer research professor, and I was at UNCC, University of North Carolina, as a research professor here. And I had my grants from National Cancer Institute as a principal investigator working on the therapeutics and the immunotherapy. But I would go for the conferences, and I would meet oncologists who would tell me women are still presenting late. And I was so connected with India, so I knew what was going on. So I felt that, here in the lab, I'm doing all these high-end technologies, but actually we are forgetting something very fundamentals, something that we need to not shy away from any concerns in the breast, and we have to break the taboo. So that's why I felt that, if I think about my career, which was going on pretty good, then I would not be able to do what I felt will help make a change. So I resigned in 2017, and that was the inception of Breast Cancer Hub. So that's how it all started, and my craziness, my family knows about that. So, but then what I felt was, as Father Binu mentioned, as Dr. Riju mentioned, that it's more like we have to go to the people. It has to be the population outreach. And that was my fundamentals too. Bring a proper sustainable solution, taking accountability, taking responsibility. It's not only about just coming and giving lecture, right? But when faced with a situation, who do they reach out to? The navigation towards the right healthcare resources. Everything needs to be taken care end to end. And that's what we do with Breast Cancer Hub. I always start with a tribute, and I'm going to bridge the gap between the developed and developing world. And I'm going to bring the situation where I feel so much that, because our forum here is an esteemed forum. We have, all in the healthcare system. So I know that small things can help make a big change in the families when detected with cancer. So that's why when I'm going to mention the instances, these are the gaps I feel that, the radiologist, it's such important phenomenal people who actually will be the ones who can make a huge, immense change. Because when I talk about, I always start with the tribute. And when I talk about this woman here, Lotika Das, we lost her in 2018. When her reports were sent to me in January 2018, it was already stage 4. And with breast cancer, we all know the stages are stage 0, 1, 2, 3, 4. So 4 means it is already metastasized to the distant organ. And we lost her. But the reason why I'm mentioning her, because when we asked her, her brother-in-law is a very good friend of mine. And when it was asked, like, what happened? Didn't you feel a lump in the breast? And her answer was, I did not know. She did not know that a painless lump in the breast could be cancer. So I always say that in addition to the taboo, it's also the ignorance. So whose responsibility it is? It is our responsibility to pass the information to the community. And I'm so happy to know what Advocate Dimple's team, Swasti Foundation, is doing, because that crusade is so essential. Because trust me, people are not aware, irrespective of socioeconomic condition, irrespective of education, women are detected late. We are losing young women every day. On the other hand, on this side, we have a woman, a very young woman at the age of 28, 29, and we lost her in 2018. And it was not because of ignorance. She went to the healthcare system, but it was misdiagnosed because of the, because of the imaging technologies, because of the dense breast concerns and all of that. So these are the other things I'm going to talk about, like how, even when we have the best healthcare system, then also the diagnosis can be missed and how we can bring that change. Now, when we talk of breast cancer, I know we always think of pink, but with BCH, you will see that in the logo, we have a strand of blue over here, and we have 4 ribbons coming together. That's what we are doing today. We all work together. But then how can we forget the men? Because though the statistics is 1 out of 833 men can get breast cancer, but I always say that man is a father, a brother, or a son of the family. So how can we forget the man? And here the picture that we see is of Marlin Washburn. And Marlin was a principal in a school in the US, but he was detected at the last stage, and we had him only 5 months from the time of diagnosis. And with Marlin, he was fighting for his daughter's breast cancer, but he had no clue that he also had breast cancer. Similarly, here, this full group are actually male breast cancer patients or survivors. And, like the young man over here, he actually felt the lump at the age of 18, so early. And that's why I always say that we shouldn't be waiting for the recommended age. And unfortunately for men, we do not have any screening processes yet, which are the regular screening. So that's why. And one more instance I remember for a man, I was in Chennai doing a community outreach, and one man comes to me and tells me, takes me to another, can you please check the my nipple area? And I touched it, but there was a hard marble, like a solid tumor over there. So I was really surprised. I said, you came for the session because you felt that lump? He said, no, I came because my sister is having breast cancer. So I came for her. And when you were talking about male breast cancer, and I felt that I have the similar thing, but I did not know that I can also get it. And we saved him. So just imagine if we hadn't, if he was not there in the session, he would never have known. And that is the situation with men. With men, the scenario is worse than women. Men feel it's a woman's disease and they're more shy to talk about it. And one of the men in the US came and told me their own kids are shy to tell their friends that their dad has breast cancer because they will be bullied. So I always request that when you're doing the crusade with the breast cancer scenario every day, please also emphasize on the male breast cancer because this is real. I know in Assam, we lost 6 men to breast cancer in the last 7 to 8 years, and they were none diagnosed early. It was at the metastatic stage. So please, mention that because with the statistics when we go, that we have no data with the male breast cancer scenario either from India. So whenever I think of any country growing stronger with the cancer scenario, being a scientist, I always feel that the data publication is equally important to bring a country stronger. And I think Kerala can do great because Kerala is always ahead with the literacy, with everything. And that's why I always feel proud when I come to Kerala. It's a very different, very unique feeling there. So basically what I say is that, in the developing world, in India, the death rate is significantly higher compared to the US, though in the US also we are estimating this many number of deaths. But why the developing world is higher? Because of taboo and ignorance leading to late detection, but also because of lack of research, where I would request that the medical fraternity to come forward. And if you want to collaborate, we can do that also, because that there's so much data lying on your table, but maybe it's not being translated in the publication form. Now, when I talk about data, I always like to show what actually is going on. Now, this is an online survey that I had done, like when I started Breast Cancer Hub. And here you can see that what is the recommended age? The recommended age is after the age of 40, we go for a screening mammogram when there are no issues. Now here, above the age of, so under the age of 40, in the US, what I saw was the mammogram, the gray bar is never. So it kind of makes sense because it's below 40. So 79% of women, they actually did not go for mammogram because that was not the age yet. But there is a turn, when they turn 40, above 40, the yes bar has grown. But what happens to India, and I'm talking here about the urban India, I'm not even thinking about the villages. Now in the urban India, you can see that the mammogram under the 40 and above 40, hardly there is any difference. But I was pretty happy that, even above 40, I saw 11% have been going for mammogram or the screening or the ultrasound. But I had a follow-up question there. And I mentioned that, did you go for why did you go for mammogram? Then the answer was, out of that 11.40%, 11% had issues, had concerns in the breast, and that's why they went. So that doesn't become screening, that becomes diagnostic. And this is really what is happening, because even in the urban India, I'm facing these challenges, and which we are trying to take care for the last 5 years with the BCH running along with the other organizations. Now, what happens is that, even with the breast self-exam, you can see the inconsistency with the clinical breast exam also. Now, I spoke to many, in my family, I have many physicians who are gynecologists, and I told them, and even many in Bangalore, I was talking to them, like, why don't you, if a patient comes to you, for a reproductive organ problem, why don't you do the clinical breast exam? So one doctor in Bangalore, and it's reported in her interview also that I take, because I do the real-time interviews so that we can reflect the real scenario. And her answer was, why are you touching my breast? I did not come for a breast problem. So that is the scenario. So, but I always say that clinical breast exam, where the doctors are doing the examination of the breast, is very, very important, because screening is after 35 or 40. So that is another area I would request the medical fraternity to please emphasize. Now, this is the data for the villages. Of course, we were not expecting any screening, because mostly the villages that we are capturing is the very untapped villages where there's hardly any screening. So this is the reality. This is the real India that I was seeing through and through, because I was doing all these interviews all across. And you can see that, she's a wonderful lady in Manarkat. When I was in Manarkat in 2019, in Calicut, Manarkat, So over there, mostly everyone is stage 3 or stage 4 detected. So stage 4 detected, we lost them, but all these women are stage 3 detected, and this woman was detected as stage 4. So what are the other challenges? What I faced was, for example, this woman over here wearing the red suit, she felt the lump early. She went to the doctor early. She was diagnosed early, but she took the alternative medicine treatment route. See, I'm not against any homeopathy. I'm not against any Ayurvedic treatment. But when diagnosed with cancer, we have to really do the conventional treatment, take the roots out. And another problem that I saw was, in parallel, there are many treatments going on. And we have not done any research to understand the cross-reactivity. So I always say that, and patients are hiding from their doctor what are the other treatments they are taking in addition to the conventional chemotherapy, surgery, or radiation, or any targeted therapy. So that is another problem that I always say, that because I meet many oncologists who tell me that the specificity and the sensitivity of the treatment, because it's not only about early detection, it's about the treatment route also, the sensitivity goes low, and that's when they realize that there are other things going on within the treatment scenario which are not brought into the limelight. So please, these are the areas also where we face the concerns. Now, in this forum, I don't have to go into detail about the breast cancer screening because you all are so, eminent, and you all are radiologists mostly here. But I want to bring to you what are the concerns I see in the US, and that is being addressed. And that's what I always tell, even in India also, and being about the dense breast concerns, because this woman, Dr. Nancy Capello, she did her mammogram, screening mammogram every year. And in 2004, she did her mammogram, but when she went for her clinical breast exam, because she went for her physical, at that time she was detected with stage 3C. And then she did the additional MRI, and that's when we got to know. But then what was the main reason? Because of the dense breast concerns. So in India, when I'm talking, because here now the regular mammogram has become redundant, we do not do that. We are more focusing on the 3D mammogram because of the better resolution. And in addition, we do ultrasound. And in India, I know that everywhere now in parallel with mammogram, we are also doing the ultrasound. But I want to bring it up that, when I try to look up because a lot of research is now going on, whether dense breast can be a risk factor too. So I want to know from the radiologist forum, when we have the panel discussion, do we see what is the percentage, what is the relation you see with the breast cancer scenario and the dense breast, or how many missed cases would you expect? What is the heterogeneity of the dense breast? Because these are the data I feel is so important for the community to know, because it's not only because people are so relieved once they go for mammogram, but definitely, we just lost someone in our support group from Bangalore, because when I went to Bangalore for the community outreach, she was a dentist by profession. Herself, she was a doctor. And when she came to me, she said, she had no clue about the dense breast issues. She was going through her mammogram. She felt the lump growing, and it missed her cancer. And just this year, just last month, we lost, and she fought so hard, but she was detected as stage 3C, but it relapsed in 2 years. So I do not want this, more women to be lost because of just, concerns with the dense breast missing their cancer. Now, what happens to the younger women, right? Because younger women, recommended ages after 40, they are all the women in our support group. And younger women, what do they do? Or those who have high risk for the family history of breast cancer or ovarian cancer, the mutation for the BRCA or other high penetrance genes. So I always request them, just that's where the solution that we brought and really works very good is the breast self exam. And I know that, probably Swasti Foundation will have their own breast self exam card that you're giving it out. So when I started BCH, the first thing that I brought was for men and women both, because we are the one organization who has developed the breast self exam card in 24 languages and all from scratch with the help of a volunteer. So for example, when I came to Kerala, I brought it in Malayalam, and my network of Malayalam friends, they actually helped me to translate it into Malayalam language. So that is what I say, that this works like magic. And I'm not going into the details of this because you all are, aware about this whole thing about breast self exam. But I would request that please mention to the community that when they do the breast self-examination, not to miss the underarm area or not to miss the collarbone, or just to do the proper correct protocol, for the full chest area, because there are times, I met women with a lump right in the middle of the chest rather than being in the breast tissues. So these are the ways, teaching the proper method of breast self-exam is equally important. Also, giving them a handout in hand. So why it is important? Because you see here, this is the sustainable solution. And as Father had mentioned, it can save so many lives. And that's what we have been doing, saving so many lives with just a small piece of paper. Because how many of us over here, though we are in the educated sector, how many of our moms, our aunt, our grandma has gone for screening mammogram? Did you even I would request the male doctors, do you even check with your mom, if they're going for the screening or not? Because I see this stigma too. Even in my family, most of my family members are physicians, but no, it's not happening. But then I saw that even in the urban community, this really works in the local languages. And then what next? When I'm going to the villages for the community outreach, I hand it over to the small kids, because they are, so, when I talk about local languages, that you can ask me this question, that the villagers, they even don't know to read and write. That's why we focus on the pictures. And then the other important thing is I give the responsibility to the small kids, because they know the local language, because they at least go to the local school. Now, is that enough? Now, no, it's not still enough, because what do they do? It's not about just going and giving the handout, right, or teaching them. What if they have any concerns? I know we have a brochure that I give out, but that has an email address and they don't even know how to do email. They're all like, you can understand they're underprivileged sectors. For them, food is the priority. Health is the least priority. But when I'm talking to them, I give my WhatsApp number to everyone. So I think that also works very good. Even if the villagers are not having the phone, the village head, the panchayat will have the phone, and they all take my contact and trust me. Even in the middle of the night, I'll get the phone calls that you came to our village, this woman is facing an issue, what do they do next? So I always try to collaborate with the local healthcare centers. We have a support group, we have BCH India WhatsApp group where I'll put that information out. Immediately we get the help, and I'll try to navigate and follow up so that they're taken care or not. So this is how I feel that this is very important, taking accountability and also following up and making sure that the treatment is being done or not, because there are many government schemes for the below poverty line, but they are not even aware about those government schemes. And those information also, we have to make sure that they're aware and they're taken care. So in the US, my impact, the outreaches are in a very different way. So based on the target audience, that is important that based on the target audience, we have to mold our outreaches. We have to mold our session. Even in the Africa also, I do the similar way, and globally through the webinar that has helped me a lot. Now here, this is another important part of BCH that I want to mention, that I feel, because we are the pioneer to do this actually, in India. So I was doing this session in July in 2019, and you see this girl behind. This was in a very remote tea garden in Assam. And this girl started to cry after my session. So I went and asked her in Hindi that, they speak the Bhojpuri language. And I said, what happened? Why are you crying? She said, why didn't you come to my village last year? My mother just died. And this girl, she was 18-year-old at that time. I felt so bad. I'd said that, because she felt that if her mom had listened to that, she would have lived, because her mom did not tell anyone that she was having breast cancer. It was more like, when it was already late. So because of the shyness, because of the ignorance. Now, my next step was that, I told her, I couldn't save your mom, but no other moms will die from your village. And that was the inception of the village adoption. And that's where, as very truly Dr. Matthew has mentioned, that, what are the main top cancers, that we cannot ignore that. And that's why we have to bring that hand in hand. And if I knew that I'm going to work with all type of cancers, I wouldn't have given the name of the organization as Breast Cancer Hub. But we realized it, going door to door. So what I started to do was, going door to door, penetrate, have the full data of them, and basically, teaching them how to do breast self-exam, training our field workers in the local cancer hospital. And I'll tell you how this mechanism works so good. But when we were doing that, we realized in Assam, in Northeast India, tobacco chewing is the #1 factor for the highest rate of cancer. So we started the anti-tobacco campaign. We couldn't ignore the cervical cancer symptoms because they were telling us about all the problems. And then we realized that who are the people who are going to do that? They are our villagers. So please know, with Breast Cancer Hub, we are a volunteer-driven organization, but the only compensation who gets are the villagers who are themselves below poverty line, because then it will be exploitation. So what I do is, instead of outsourcing, I have this village, the college-going girls or women who are in financial constraint. I train them in the local cancer hospital, so they're trained, and then they can go door to door and do the screening. But so from that particular methodology, from zero awareness, from one village in Assam, we adopted 11 villages now, and it started in 2020 February, and no one was detected late, and everyone was aware. But what are the main challenges? Do you think that if our field worker had gone to them and told them, you have a lump in the breast, you have to go to the hospital? Even we work with the Anganwadi workers, we work with ASHA workers, but it's not, the success rate is not as much. Why? Because for them, food is the priority. The other problem is they are daily wage earners, and no other family member wants to accompany because they are going to lose 2 people's wage. So what happened was, every step we had to improvise. So what we did was, and the first thing that we do was collaborate with the local hospital, right? So I always go and meet. So Dr. Padma Shri, Dr. Ravi Kannan, he is in Kachar Cancer Hospital. Silchar Medical College gives free treatment for the underprivileged. Because whenever I'm thinking of the treatment, I have to think for the underprivileged sectors where they will get. Because with Breast Cancer Hub, our revenue is very less. We have no government aid. We run by some donations given by our community in the US through like bake sailing, through different ways. But then coming to here, so what happened was, we started to build the team. Our team would accompany the patient to the hospital, sit with the patient the full day, take care end to end, generate the income certificate also. So we started to build this relationship, and now, everyone, the trust became so important, because we were protecting our villagers from end to end. And even whether they're taking care of their treatment or not, the follow-ups is equally important, and bringing them back for the follow-ups and doing the counseling. And that really works magical. But also, you should remember, what we did was, during the COVID time, prime COVID time, because I lost my father on 22nd February 2020. So I was in India. So I jumped back on the 4th day after he passed away, after I finished all the ceremony, in it, because I couldn't stay at home at that time. So that's when the village adoption project started. But then right after that, COVID started. But so COVID, we were doing everything we could. But this is the recent flood that we had in Assam, and I was right there during that time. So what I want to say is, when we are adopting the villages, the sustainable model will come when they have food in their stomach. Because how will we take them to the hospital if they're suffering so much with the flood, with the natural amenities, with the COVID scenario? So that also we take care, and we collaborate with other groups, and we make sure, because we have data for every household, because we are going and analyzing, we are doing the survey for every household, and knowing that who are the suspicious cases. So every week we have all the different cancer suspicious cases, and then that's how we take them to the hospital. Now, similarly, in Tiruvallur district, we have adopted a village called Bhagat Singh village, and also in the Nadia district, we have expanded this time when I came to India for 3 months. So that's what we are doing now. So we have expanded in other villages also in different parts of India. But so that was the villages adoption that really works very well. Now, the next part that I want to talk about is another sustainable model that we are trying to create. This is not only about the early detection, about this diagnosis, about the treatment, but also about the support. Because, for example, this woman, when I went to meet her, when the nurse told me in that area that we have a stage 4 breast cancer patient, when I met her, she was lying on the floor. And I was shocked, because she was getting free treatment. So it's not also about the free treatment, but then no one told her that if she stopped her treatment, she it's not a treatment for flu or fever, right? We have to complete the treatment. So she was diagnosed early, but she did not go for her treatment because she had to go to the field in the tea garden because she had to get her son's school fees. And that's how she missed her treatment, and the cancer cancer spread out. Now, when I went, why she was lying on the village, because no doctors, no one told her or her family that cancer is not contagious, because our society plays a significant role with creating the myth, so many false information and lot of information given to the family, though they don't, even if they do not want it. So what happened was that, I couldn't take it. So I put her on the bed, but then I told her family that cancer is not contagious, because what they thought was cancer can spread from one person to another. So I explained, and then, after months, her family, her own son and daughter hugged her. I couldn't save her. Of course, she was on the last stage, but when I was coming out and the smile she gave me, that was my biggest reward, because I knew that she was going to die in the arms. She knew that she was dying in the arms of her family. So that was the concept of support group, because when I was going through the small areas in India, small town, the support group concept, yeah, in Bangalore it's there. There are many big hospitals who have a support group wing, but what about the small towns? And I met women, during the interviews I showed you earlier, they were telling me, can I talk to other breast cancer patients? Because there's a so huge emotional turmoil. It's not about the medicines alone, it's about the emotional turmoil. I get patients reaching out to me saying that, my hair is going to fall, I don't want to do the treatment. Who is going to take care of them from those angles also? So that's where I created a very private WhatsApp group, which is, so the local support groups are local, but with the urban society, I created this WhatsApp group where we have women from local towns, from big towns, from Bangalore, from Kerala. So, as I said, I was in Kerala. So from Kerala, we have patients in our support group who reach out, trust me, when they have concerns, because they have the contact and they're added to the support group, where we have oncologists, where we have, and all our volunteers. It's such a beautiful feeling. But many oncologists told me, when a survivor gives that message, is like if a patient is asking question, a survivor's response through the experience is the best answer. So that really works as magic, because me, as what I cannot do as a scientist, an oncologist cannot do, a survivor story does that. And that's why, we have patient stories, survivor stories I posted on our website in local languages. Please leverage them. Everything with BCH is free of cost. With a lot of difficulties, I could collect the stories, and this work is magic. And because, for example, this is an interview in Kannada, and when someone reached out to me like 2 years back, saying that my mom doesn't want to do the treatment because she says she's old, and her friends said that anyways you are going to not going to live long. Why do you want to suffer like this? So then I sent this interview of an amazing woman who says that, I'm cured and I'm having the best time of my life, and I'm reliving my life and doing things that I always wanted to do, but I never did. And then that interview works great, because then they will come back and say that, now my mom wants to do the treatment. So that is the power, because for me, our cancer advocates are our heroes. And this is an example of Jessica, because here another point I want to mention is that the marriage part and the family life. Because I met women in India, they are all I met a woman working in a MNC. When her marriage was fixed at the age of 28, she got breast cancer, and her would-be brother-in-law, who is a renowned oncologist in India, in Bangalore, he broke the marriage because, she had breast cancer. Unfortunately, when I was doing all these outreaches and I was in Dibrugarh, a very educated family. So what I do is, because all expenses are mine when I'm doing all of that. So I try to stay in villages. Also, I stay in the villagers' houses. So whoever keeps me, I'll say, I'll just stay at your place like that. So I was staying in a household, a very educated household, and the woman tells me that, my my husband's brother's son is getting married, but we are breaking the marriage because the daughter, we got to know her mom is a breast cancer survivor. So these are the myths. So when we do the outreaches, we have to cover everything. So with Jessica, I always say I'm so proud of her. When she reached out, she was 25-year-old, aggressive type of breast cancer. Breast self exam saved her life. And she, while doing her chemo, her wedding was scheduled. And while she was on her 6th chemo, she got married on the same day. She finished her treatment, gave herself some time, and now she's having a beautiful baby. So cancer is curable. Early detection is the key, but also that positive attitude. And I always say that 80 to 90% randomly anyone can get breast cancer, right? Or any cancer. Only 5 to 10% is genetic mutation. So when some family says that we do not want to get my daughter, my son married to the family, I always say speak science, because, you know, if another important thing I want to mention is that, you know, I always bring this up that in your family, no one is going to die from breast cancer, because the girl you are bringing, she's so informed because she has seen this happening. So she will be always helping others to be detected early. And also the genetic testing needs to be done, because even if it is 5 to 10% bucket, there's 80 to 90% randomly anyone can get breast cancer. So when we speak with science, people listen. And that's how we have, you know, stopped so many marriages to be broken because of the outreaches, which cultivates every different areas, and also the caregiver areas. We also focus on the caregiver because, you know, when detected with breast cancer, any cancer, the full family is shaken. The palliative care is not just the end stage care. We have to take care from the beginning. We have to educate the caregivers because they are equally going through so much. The other area that I'm focusing is on the transgender population. And I have a huge request to the radiology department. I'm trying so hard, you know, like, because they need that acceptance, and they have given me interviews saying that they are scared to go to the hospital system because there are so many trans women, trans men. You know, the trans women, when I go for the outreaches, they will tell me how there are discharges because of so many hormonal injections they're taking. So the rate of breast cancer is higher in the trans women compared to the men themselves. So, but then they have no place to go. So I wish that, you know, we can form a group and we actually go and do the screening on their spot, you know, where they are living. And that's what we want. So this time when I was in India, I had a plan to do it in Chandigarh with PGI, but in the last moment, PGI said they were busy. So though I scheduled everything and I had my tickets for Chandigarh, but we couldn't do it. But we did the awareness session before that for sure. So that is where I want that, you know, so much focus to be laid also in different other genders too, in LGBTQ plus community too. But in addition, the research part, because our research is IRB USA approved and ISC India approved. So our ethics committee approval is with St. John's Medical Hospital in Bangalore. Our co-PI over there is Dr. Rakesh Ramesh, who is the head of the surgical breast cancer oncology department. So there we focus more in India on trying to understand the retrospective part, the clinical data analysis, the population-based epidemiology research study, building life-saving educational materials. And that's where I would really reach out to the radiology department, because, you know, so many ways we can bring the untapped sectors, which is not even known with the research scenario, because we have so many, like you are doing the x-rays every day. What is the population of dense breast we are having? Do you see a correlation, as I was mentioning earlier? Because that can really help to find out if the dense breast concern is a key risk factor. So this were all about how at the grassroots level we are working. So with the research part, we are trying to change the healthcare policies. Like here in Charlotte, in USA, I'm working with the local hospitals so that we can push towards, they want to know where I see the gaps, and I mention it to them so they can push towards in those areas. I'm also working in the male breast cancer so that we can develop a screening protocol in addition to the breast self exam we develop, so that men have a say too when they go for the screening. Now, when it comes to the key risk factors, I'll just end up in another 5 minutes. So when it comes to the key risk factors, I always mention about the term inflammation, because, after COVID, inflammation anyways is a big word, but did we know that, inflammation also can play a role in the initiation and the progression of cancer? So my work on breast cancer and arthritis. So, during inflammation in arthritic condition, there are many pro-inflammatory cytokines which are upregulated. And what I have seen was that when we have breast cancer, the tumor cells are attracted towards the inflamed areas more because of some signaling pathway. And this work got press release in 2012 from American Association of Cancer Research, because we were the first ones to discover this. Now, I'm not going into the receptor and the ligand status, but the reason why I'm mentioning this is that during cancer also, we may have many chronic inflammatory underlying condition, and that is very important that we target those conditions, because otherwise it adds fuel in the fire. So when we are talking about the key risk factors, please bring to our community the inflammation factor also, because we have seen in Mayo Clinic when I was doing all the research, and this research of the inflammation, I started in Mayo and ended in UNCC in Charlotte. But in Mayo, many were doing the research on asthma, which is an asthma, and also the breast cancer, other cancers. So there's a huge correlation between inflammation and other cancers. I would request that also to be taken as a key risk factor. Now, when I'm talking about the other key risk factors, the family history, I always, I know you all are so much informed about the BRCA mutation and about other mutations, but one thing that I want to request is that, did we know, do we ever ask the men of the family to go for the genetic mutation testing? Because the BRCA mutation or any mutational genes can be carried by the males also. And the men are not only prone to breast cancer, but also to prostate cancer, digestive tract cancer, and other types of cancer. So please, I would request, if you know any family where ovarian cancer and breast cancer runs, please ask the offspring, the males or the siblings who are men, to also go for the testing. And not only for the BRCA, nowadays we ask requests for testing for the all other, the full panel, because we are finding that there are many other high penetrance genes also that can lead to, they may have the promoter for breast cancer or other type of cancers. So the tobacco, as we all know, is the leading cause of cancer. So I'm not even bringing this up. But then with the tobacco, one interesting fact happens is that many times when I mention this, a lot of people think that tobacco smoking is only related to lung cancer, which I know that you all are aware that it can lead to cancer in other parts of the body. So I always say that, it's not about one cigarette or 100 cigarettes, or, people, a lot of times, many people say, I only have one cigarette in a day. No, tobacco is a total no-no. Even the alcohol, it shouldn't be made as a habit, because alcohol also leads to underlying inflammation. Obesity leads to underlying inflammation. So basically, cancer is not a one-day development. It is multidisciplinary effect. In the long run, the effect shows up. So that's why a healthy lifestyle is very important. The work environment is very important. If we are having any background radiation that can be leading, we are not, when I work in the lab with radioactive materials, I would always have a badge monitoring. So whether the safety is maintained or not, if we are working in an environment where we are exposed to different kinds of radiation. Now, like in Bangalore, one man came to me when I was doing the outreach, and he told me that his mom had stage 4 lung cancer. This was in 2019. So when I started to dig deeper, I got to know that she was working, she never smoked in her life, always ate healthy. But then she was working in a factory where there was huge intake of smoke. And there was no safety measures to wear mask. I'm talking about 2019 when COVID didn't even come in. So that was one of the reasons. So because she developed that. So we should be very vigilant about the environment, about the food we are eating, about the water we are drinking. And when it comes to food, we always know that, there are free radicals in the body which are generated, and they contribute to damaging the DNA of the cells. But then there are antioxidants which will, donate an electron and stabilize the free radical. But who is giving this antioxidant? Our food, like, good food, like curcumin in turmeric, ginger, fresh onion and garlic. And I always say that, but when I do the sessions in the US, I always say that please do not think that turmeric will cure cancer, because then no Indians would have had cancer, right? Because we all are feeding on turmeric every day. But always it is rich in antioxidant as a preventative measure. But I'm still in favor of the natural product rather than buying capsules from the market and using them, because natural and keeping a balance, not overdoing things. But when we are going through treatment, we should not be overdoing anything. We have to have a balance, and when we have to keep our doctors informed. So this was about, I'm not talking about other types, but we have developed other type of cancer screening cards also, and anyone can download and share it. But that was the key risk factor. This is my last mention that our advocate has mentioned earlier. So very nicely that about the youth. Yes, so my torchbearers are the youth. So who are the leaders who are taking the message of Breast Cancer Hub forward in Charlotte, in India? I have students from all across the globe. They are the youth, because I always feel that if we break the breast taboo within the minds of the students with the young brains, they are the ones who are spreading it in their network. And trust me, we have the culture, we bring our culture in US also. So this is a culture-induced inertia not to go for the breast cancer screening. And this, we bring it here also in Charlotte, in the US. And our kids are the ones now to go and push their parents. And what I tell them is, many are rooted from India. So you have to pick up the phone and motivate your grandma, your aunt in India to go for screening, and also make sure they're doing it or not. And if they have any concerns, they can reach out to me and I'll help them to navigate. So this method also, trust me, has saved innumerable lives. So that's why, I feel that's the beauty of, when we work together, because what I always say is that, when I started Breast Cancer Hub, a lot of people asked me, like, how do you differentiate, Lopa? And I always said, why do we have to differentiate? We are fighting for the bigger cause of cancer. And that's where our tagline is, together we save lives. And I cannot be more grateful, because today you brought me to this forum. And I hope that, our relationship will grow so that we can work together. And I'm planning to come to Kerala and we can do more things together. Thank you so much. And thank you for listening to me today.
Thank you so much, Doctor, for your excellent, coverage of the whole topic, because I know doctors will be quite aware of the content and everything, but laymen like us, we were just absolutely impressed. And I should say namaste to you for just throwing away that lucrative job in a country like US and coming back to India and coming back to your motherland, Assam. I know it's a remote part of the country, and giving back whatever you have learned from your motherland, giving back to the downtrodden, and always pursuing. And there was a lot of positivity in your whole topic in which you conceived, because you always perceived everything on a positive note. You never had a negative comment that people are not coming, nothing of that sort. You always took everything on a very positive note. Thank you so much. From a layman point of view, I should say thank you so much for your very, very, very mind-blowing concept introduction and your effort to the humanity. Thank you so much. Over to you,
so
Dr.
much.
Rijo.
Thank you,
Dr. Roy, wonderful talk. We are all quite inspired and motivated by the work that you are doing. And let me, this Onco Summit that we had in Trivandrum, of course, Padma Shri Dr. Ravi Kannan also was there in Trivandrum for this Onco Summit. This was in that summit, we have identified, we have discussed on, deliberated on several aspects of one on cancer literacy mission, and again the role of women empowerment groups, and especially the Kudumbashree in Kerala, and the role of National Service Scheme, or the students called the Lavender Army formation, something that you're already working on or you're currently working on, is something that we are also, we would like to make use of it in the Kerala Cancer Crusade too. So I think Dimple Mohan from Swasti Foundation and the team in Trivandrum is doing a phenomenal work there. They can take it forward in a big way. And from the professional point of view, from the Indian Radiological and Imaging Association, and especially from the doctor's point of view, what we wish to have is a network of service providers and the medical professionals with whom the skilled navigators like the women empowerment groups and the ASHA workers and all, they can connect or even get appointments and facilitate the screening protocol programs for the for the women groups or the target groups. So these are the areas that we are currently looking at it. But as you rightly said, there are challenges challenges here. One of the major lacunae that we have been already highlighting in this series of webinars is many a times patients coming to with stage 3 or stage 4 cancers, especially breast cancers, they might have had consultation with their general physicians or surgeons or gynecologists, but the opportunistic screening that could have been possible at that levels of healthcare, either in a primary or secondary levels of healthcare, are totally being lost. And there needs to be some sort of an targeted program or targeted awareness or screening programs or protocols to be introduced amongst the general practitioners and the physicians and surgeons at the primary and secondary levels of healthcare. And secondly, that what you mentioned about the people who are already coming to the radiologists for screening tests, including mammography. It's already well known that in a fatty breast, the pickup of lesions is there of 98%. But when it comes to dense breast, it's only 48% if it's for extra mammography. So there has to be some kind of a methodology to including 3D tomosynthesis and all these things, which are right now available only in tertiary centers. You just cannot think of having a 3D tomosynthesis at a primary or secondary levels of healthcare. It is practically not possible. There are some new developments. The Professor Ang Kwan, who had been here from University of Malaya, who has done a phenomenal work in breast density and using artificial intelligence to further categorize those breast examination which are on dense breast, which requires further workup. But again, all these things are something that can happen at a tertiary level at a different level of workup. So the challenges of a dense breast it by itself has got a 6 times increased chance of having a breast cancer. That is something that all of us has to understand. But evaluating a dense breast has got a lot of challenges from the radiologist perspective too. One more point I just want to ask you is, so we have already embarked upon this mission of Kerala Cancer Crusade and Cancer Literacy Mission. It's an 8-year project that has been targeting to bring in the private and public enterprises all over Kerala and to create this cancer awareness, and to also to bring in or train the skilled navigators to facilitate to increase the awareness and also to facilitate the screening programs with the network of service providers. And one such initiative that we already mentioned will be inaugurated in Caritas Hospital is an NCD clinic. Government of Kerala also has has got a Shaili app with which they're collecting data using from the population. Half of the population is now covered. They're collecting data on the high-risk groups for cancers and lifestyle diseases. And that can significantly give information about the target group that we need to focus upon. But even after that, once you identify the high-risk groups, there is a real challenge of screening. And government sectors alone may not be able to cater to the entire needs. And then that is why the private sectors has been roped in now to start the NCD clinics and screening programs. And they can have the satellite centers, which can again connect using telemedicine. But Caritas Hospital in Kottayam is starting that center, and they're going to connect Idukki and the hilly. There are all hilly districts, neighboring districts of Idukki, Pathanamthitta, and they will be having the satellite centers there and to facilitate this kind of a screening program. So we have connecting all these different stakeholders, trying to bring them together, and your efforts in this field is something that is really giving us a roadmap to work upon. So thank you very much, and we would like to have more collaboration with you in this endeavor. And Dimple, would you like to add on anything more?
Yes, something which was quite significant and something which I noticed was that the whole modus operandi of how Dr. Das has been implementing is on the reverse model. Because normally what we do is we go, we ask them to come for screening, we do the screening and then they leave them. But the way she has been implementing is it's on the reverse side. She ensures that if you are subjected to screening and if you are diagnosed of cancer, you will have a lot of stigmas, your livelihood is affected. So she goes on a reverse model. She says, okay, I'll ensure your livelihood is not affected. I'll provide you the livelihood and then you be guaranteed that you will be taken care of. And now why don't you come over for a screening? So that was a quite, what do you call, a reverse model of ensuring that you are not affected financially, economically, and mentally. You're not affected because you have a, what you call, a feel that, okay, I am taken care of. Now I can subject myself to screening. So that model had a lot of humane touch, as Father Vinu Kundat had said. That whole, because rather than we going bluntly to the people and asking them to come over for screening, she went through a very humane model kind of screening approach. That was quite impressive. Thank you so much for that.
Thank you, Ms. Dimple. I want to add here that, even if we give food also, but bringing them to the hospital is the biggest challenge because, when we started this, it was during the COVID time. So patients, we were like having this, as I said, expenses are, we have to take care of every penny because we don't have that much money either. So that, but then we would have this transport ready for them. We would bring them to Dr. Ravi Khanna's place, Kachar Cancer Hospital, or Silchar Medical College. And we figured it out which hospital is giving like totally free or which was little subsidized. We would measure every penny. So
every penny counts, isn't it?
Every penny counts. And then we would, so they wouldn't want to go because they were scared that hospital will have the COVID test running. And if they are detected, they will be detained for 14 days. So my goodness, everything was such, and every night I would be talking to the project coordinators. I was there and then I came here and then I couldn't go for the COVID scenario. So, but then still we made it, if I say that we didn't let anyone get to the late stage, even during the most COVID time, because I think the trust is also very important, Ms. Dimple, because we built a relationship. Because when I started, everyone was skeptical. They were like scared, like, who are these people? And that's why the local recruit was very helpful. But then eventually, over the years, now this time, like when I went in November, when I went just came back during the summer, they would be like, when I go there during the COVID time also, no, they would just come and hug and, so they were like, which before they used to be like, who is this person, coming and invading our place? So I think trust is very important. Building a relationship is what works. Even in Tiruvallar, when I came, I went and did the outreach. I went and met everyone, and there our field workers are one woman who just delivered a baby, and I said, you can do it. I went back to work in 6 weeks and 4 weeks after C-section. You can also do it, and she is going to be the leader who to work with me. So so that way, those I think when we do something from our heart, God will take care. I think that's what I.
State of Assam is very much blessed to have a daughter like you, because whenever Assam has faced a crisis, you have been there. Come the floods, come the COVID, much dependable daughter has come back to their rescue.
And Dr. Roy, just final question to you. So as Advocate Dimple has rightly said, you have given a holistic approach to the whole issue. But there you are a very good mentor. And how did you develop these leaders and the volunteer group? Just what are your tips and tricks for us to?
Oh my God, that's a great question, So I'll tell you this, what happened. As I said, maybe there was a signal. I don't know. I always believe that there's a strength from somewhere that comes in, Dr. Mathia. I believe, in God so much, because I feel that when I told you about the story of that village where one girl was crying, the inception.
Yes.
So my dad always used to tell me that, he couldn't do it with his health, but he said, I can take care if you had a village like that, he would say. So in 2019, I thought about it, and then I came back. So the woman, the lady, her name is Sana Lembi for the Assam village. She's a Manipuri woman. So what she did was she was the one to invite me for that, organizing that outreach. And I really loved the way she worked. So I identified with, I saw that passion in her. but then she was working for another organization at that time, and by which she did this, invited me for this outreach. So when in 22nd February 2020 I went back, and in between, in October 2019 I was in, so July 2019 is when I decided. October 2019, my dad had a heart failure, so I had to rush again to India. So my dad he became okay, and he told me, now I know you're going to go back to the field. I know you came to see me, but you will not rest in peace, right? So then I said, yeah, you are right. So I called Sana. I said, Sana, can you give me a good person who you can rely, because I really want to start this project. And her answer was, oh, I just resigned from my earlier work. I can work with you. So I said, okay. And then, it was just, I don't know how that happened. And then I had to come back in February when my dad passed away. I went back, and that's when she was already working. She knew these girls, and she said, I'm going to handpick for you. And we interviewed. And these girls are amazing, Dr. Matthew. What can I tell you? So one girl, she is a tea garden laborer's daughter. She lives in a very, she walks like 2 hours to go to her college. But then she has been with me since 2020 February. She is now completing her BA, and now she wants to do her MA in social work. And this experience is going to help. She bought a scooty for herself, by which now she can go to the main road. She doesn't have to walk, and she is paying. It's a very small compensation, but that actually molded her life. So another field worker is someone whose husband doesn't work and her mother-in-law is in the bed all the time. So that 5,000 rupees or 7,000 rupees compensation is helping them to run the family, but we handpick every field worker, and we see for some time. If they are not passionate, then we let them go, and then we have someone else. So that's how we mold them. And I think it's wonderful the way our teams are. We function like family. We'll eat together when I'm there. So I think that's the magic.
So that's a great mentoring effort, and the passion with which you are doing, and the passion and the trust that you have given your team is making a lot of difference. So I once again congratulate Dr. Lobamudra Das Roy for the wonderful work that you are doing. And I think Sosti Foundation and IRIA Preventive Radiology has got lots of lessons to learn from this talk, and we have to put it in use, and we have to for the Kerala Cancer Crusade and Cancer Literacy Mission, we need the guidance and help from Dr. Lobamudra Das Roy also.
Absolutely. I'm always here for you whenever you need me.
We had Mr. Krishnananda Pai, founder and president of Malabar Cancer Care Society, also here in one of these series, who is also doing a phenomenal work. He is having a holistic approach towards cancer screening programs in the northern districts of Kerala. And they're taking care of Malappuram, Calicut, Wayanad, Kannur, and Kasaragod. They're doing phenomenal work there. And there are a lot of people who can guide us in this endeavor. So it's time to wind up the session today. Once again, thank you, Dr. Lobamudra Das Roy, for the wonderful, motivational, inspirational speech and the lecture that has given us lots of insights and guidance for the roadmap of Kerala Cancer Crusade and Cancer Literacy Mission. Thank you very much. I also wish to thank the moderator, Advocate Dimple Mohan of Sosti Foundation, whom I am sure is going to take all these lessons and put it into action plan with the help of the Sosti Foundation. Has got a lot of a very, very dedicated and passionate team. Most of them are based in Trivandrum, but I think if they come into action, I think there will be so many Dr. Lobamudra Das Roys from whom we will be hearing in the near future. So thank you once again, all the delegates. And once again, I wish to thank our chief guest, Father Binu Kunnath, and Dr. Amal Anthony, the President-elect of IRIA Kerala. Dr. Ansar could not make it due to some connection issues. And thank you all the delegates once again, and to Soumya and Avni, who has made this session possible today. Thank you very much.